I chose cesarean section, also known as C-section, as my surgical procedure. A cesarean section, commonly called a C-section, is a surgical method of delivering a baby. The procedure is performed when vaginal delivery is unsafe for the mother or baby, such as in cases of fetal distress, breech presentation, or labor complications. The basic anatomy is that this procedure involves several layers of anatomy, including the skin, subcutaneous tissue, abdominal muscles, and the uterus, which is where the baby develops. My first instrument is the Mayo scissors. The Mayo scissors are classified as cutting and dissecting instrument. They are used to cut heavy tissue such as the fascia and muscle layers of the abdominal wall. In a C-section, they allow the surgeon to make precise incisions through these tissues. Sterile processors inspect these scissors for sharpness, smooth joint action in the absence of crack or rust. Instrument 2 is my Diva retractor. The Diva retractor is a retracting slash exposing instrument. Its function is to hold back the abdominal wall and organs, providing a clear view of the uterus. Instrument 3 is a pulley suction tip. The pulley suction tip is classified as a suction slash aspiration instrument. It removes large amounts of fluid, including amniotic fluid and blood, from the surgical site. During a C-section, this helps maintain a clear surgical field. Sterile processors check that all holes are clear and the tip is free from damage or corrosion. Instrument 4 is the Mayo Hager needle holder. The Mayo Hager needle holder is a suturing instrument. It is used to hold surgical needles securely during closure of the uterus and abdominal wall. In a C-section, it ensures precise suturing. Sterile processing checks the alignment of the jaw, smooth locking action, and overall integrity of the instrument. This here is my anatomy image. The image highlights the key anatomical structures involved in a C-section, including the abdominal wall, layers, and the uterus. Understanding this anatomy ensures the proper use of each instrument during surgery. Inspection and safety notes. Each instrument must be carefully inspected by the sterile processor to maintain safety and functionality. Key areas include checking scissors for sharpness, retractors for bends, suction tips for blockage, and needle holders for alignment and locking function. Suction tip ready to clear fluids, scalpel for incision, retractor to hold open incision, clamps and scissors for tissue, sutures for closing. Summary is a C-section is a surgical procedure for delivering a baby through the abdominal and uterus. The 4 instruments highlighted: Mayo scissors, Diva retractor, pulley suction tip, and Mayo Hager needle holder. Each play a role in performing the procedure safely and effectively. The key takeaways here are: cesarean section is a common life-saving procedure for mother and the baby. Proper instrument selection and use ensure surgical success. Careful inspection of instruments, sharpness, alignment, cleanliness prevents errors and keeps patients safe. Sterile processing plays a critical role in protecting patient outcomes. Thank you.